Just imagine we could understand what's wrong with our bodies by actually looking inside them.
Wow, that is something. That's amazing.
This series is all about helping families who, just like mine, are trying to get to grips with health challenges.
It's always there in the back of your mind.
It takes away your happiness.
I just want to know the truth about what's happening in my body.
By bringing people together with state-of-the-art technology, let's flip the visors down on our headsets. We'll let them literally see beneath their own skin.
So let's peel away the bones.
Wow, look at that.
Gosh, I have never seen anything like this.
Is that my prostate? It's like a big haggis.
It's just really incredible to see inside me.
Working with the country's top doctors, they'll have a medical consultation that will truly astonish.
So you can see the healthy uterus here, and this is yours.
Just to say, these are your breasts. Helping them to not only understand their condition.
That is what's causing your pain.
Oh, really? Oh, truly, that looks startlingly different, doesn't it? But also make the key treatment decisions they need to get better.
What we'll be doing is removing all of the left lobe.
You can see it's shrunk right down to almost nothing.
Now I can see it for what it is, and I want to get it removed, and I want to be better.
Oh, bless you. I'll be there for every step.
How was my brain?
As we use the power of technology.
You're incredible.
To bring hope to our lives.
Knife, please.
I will never see life in the same way again.
So thankful for the care that you and your medical team, without you, I wouldn't be here today.
This is your health as you've never seen it before.
Quite handsome, isn't he?
I think for all of us, the last couple of years have been full of fear. You know, never before as a nation have we all been scared of the same thing. We don't want to be scared stiff to put a foot outside the front door. We just want to feel like we understand a little bit about our bodies. And then when things do go wrong, or we get a pain or an ache or something that just isn't right, we can go, okay, I'm going to look into this and I'm not going to be frightened of it. We're bringing patients and their doctors together in our unique imaging centres, where they will have a mind-blowing consultation that helps them get to grips with their condition from the inside out. With the help of consultant Dr. Guddi Singh,
So let's have a look at the scan, shall we?
they'll get the ultimate insight into what's really going on inside their bodies.
With the latest technology and augmented reality, we're going to show you your body in a way that you've never seen it before.
The first patient to our main imaging centre, here today with her husband Johnny, is 71-year-old Rosie.
We met when we were 15, we married when we were 21. We've been married for 50 years, so that makes 56 years altogether. We have 5 daughters, 5 gorgeous sons-in-law now, and 23 stunning grandchildren.
Hello! Hello, everybody! Favourite granddaughter! My favourite granddaughter.
I speak to them all once a day,
Hi, everybody. Hi. Did you also a little bit like the sound of music?
and one granddaughter comes for supper by herself one night. Another grandson I pick up from school once a week. I read to the little ones. We're going to serve 2 different soups, chicken soup or chunky vegetable. And the older ones whiz over on their bikes and raid the sweet cupboard and the fridge, play the piano or whatever it is they want to do here. That's very wonderfully warming. Right, rolls and vegetables are on the table, meats are here.
Clearly, family is a huge part of your life.
Oh, yes. Oh, yes. Without them, I don't know. Hello, Kate.
Lovely to meet you both.
Likewise.
Lovely to meet you too.
So, how did you two get together?
Way back to 1965. We had to wait 6 years to get married because you can't get married when you're 15.
I think it's a good arrangement.
And it don't seem a day too long.
So, life is looking pretty good, I imagine, until the pandemic hit. And now we're a year on from that very first lockdown, coming into the summer. And at this point, you must have been thinking, we're getting through the worst.
They told us we could take off our masks, and we thought everything was fine, everything was getting better, until this hit us.
Oh, you're welcome.
Anyone for chicken?
8 weeks ago, Johnny started feeling ill after a family trip to the Peak District.
He looked not well, which is unusual for him as well, so I took his temperature, which was way up high. The next morning, we decided to do a PCR. And we went to the local drive-in place, and his was positive, and so was mine. At the weekend, on the Saturday, I was feeling not so good. He was already completely better. I was not well on Sunday and Monday and Tuesday, getting worse every day. But still, you know, I was functioning. I was okay. Not so good.
You weren't okay.
Rosie's condition quickly deteriorated. Johnny rushed her to hospital, where she was immediately placed on a high-dependency COVID ward. She wouldn't leave hospital for 11 days, and now just 6 weeks after being discharged, she's still recovering from the virus.
I just thought to myself, I'm never coming out of here. I've never felt so bad in my life.
As I think you know, my husband got sick at the very beginning of the pandemic when they didn't even really know the effects on the body. A lot of them, of course, we're still discovering now. What do you hope that seeing the impact of COVID on your lungs when you were in the throes of it, what do you hope it will bring to you?
It would close the circle for me to be able to understand in a visual way what it was that happened to my body that made me so very sick.
I want to see what the words can't actually tell you. It's all been described to me up till now, but to see a picture tells you so much more than words ever can, and more than that, to see the picture of the inside of the body.
It's almost overwhelming, but I want to get past all that and see if understanding it from a different perspective will help me to put it into that plastic bag and consign it to the dustbin.
Here to show Rosie just how COVID affected her body.
Hello, everyone.
Is Dr. Guddi.
Hi, Rosie. Lovely to meet you. Do you want to come with me?
I'd love to.
Johnny, you come with me.
She'll be joined by Dr. Ernie Wong, the respiratory consultant at St Mary's Hospital in London, who treated Rosie and is now in charge of her ongoing care as she recovers.
So I hope through this experience that Rosie would be able to understand what COVID really is and how it's affected her body.
Oh, my goodness.
Hi, Rosie. Very nice to see you.
Very nice to see you too, my knight in shining armour.
If you're feeling ready, shall we go and do it?
I am. Let's go.
This is a medical consultation of the future. The key organs in Rosie's hospital scans have been converted to spectacular 3D augmented reality. So what she sees is actually her own insides. I'll be watching next door with Johnny.
Are you intrigued by it?
I am absolutely intrigued.
So, Rosie, we're about to see your body. Are you feeling ready?
I'm absolutely so excited.
Well, if you're both ready, shall we put our headsets on?
Mm-hmm.
Okay.
Wow, that is something. That's amazing. Absolutely beautiful.
I can actually see Rosie's heart moving up and down. This is absolutely mind-blowing.
It's extraordinary, isn't it?
So this is your body, and if you can see inside, that's your heart and your lungs in there. Come and have a look.
So these are the lungs.
That's it.
And where did you say the heart was?
Can you see it beating right in here?
Oh, oh, wow.
Not everybody gets to look at their own body like this, so come and have a walk around and just
unbelievable.
appreciate what it is.
Oh, and they wrap all the way around the back. They follow your rib cage all the way around.
And then you can see this little sheet of muscle here. That's your diaphragm. That's the muscle you use for breathing.
It's the most fascinating thing I've ever seen in my life.
I would have done better at biology in the 5th form if I'd been shown things like this rather than just reading it all from a textbook.
To help Rosie understand why COVID affected her so badly, the doctors need her to see what's under her rib cage.
Let's get rid of your skeleton.
Wow. I can't believe how big your heart is.
That's your heart, it's not mine.
Should it be big? Is that a good thing, a bad thing?
Well, it's normal, it's appropriate for you.
It's appropriate.
Rosie. Yeah, it's appropriate for you.
I feel like I want to touch it. I know it's not really there.
Touch it, go for it.
Wow. It's like it should be there and feel spongy. Quite amazing.
Now that you can actually see the inside of your body like this, what are you thinking?
Well, when something so dramatic happens to your life and scares you to death, and you think this is the end of it, it's quite an eye opener.
What I want to do is just to take you through how the virus actually gave you the disease. Ernie, can you tell us how it gets into our bodies?
Sure. We know that the virus is airborne, is transmitted through aerosols. Someone coughing, someone sneezing, and you breathe in the droplets. So it really starts at what we call our upper airways, so our nose, our mouth, and our throat.
When the COVID-19 virus settles in the mouth and throat, it invades the body's cells, forcefully reprogramming and repurposing them to clone more of the virus. As it multiplies over the coming days, the body releases white blood cells and antibodies to try to fight off these alien invaders. If the body's defense is slow to respond, like in Rosie's case, the virus may spread as far as the lungs.
When you first met Ernie, it was really when your lungs started being affected. So we can actually have a deeper look and see more in your lungs.
Oh. Oh, my.
So, Rosie, as we say, your windpipe divides up into many, many, many branches of airways. And we always say it's almost like an upside-down tree. So you have the big tree trunk, which is the windpipe. Then it divides up into the big airways, we call them the bronchi. Then it gets smaller and smaller and smaller, into so small that you can't even see the airways.
Fascinating, isn't it?
When we breathe, air flows in through our mouth and nose, down the windpipe, and through these smaller branches within the lungs to provide our body with the oxygen we need to live. The COVID-19 virus uses this flow to travel deep into the lungs and into the smaller airways where they settle and multiply. And it's the damage caused here that the doctors want to reveal inside Rosie.
Are you feeling ready to see it?
I am.
Okay, let's put our visors down.
Wow. Wow, that looks so angry.
The coloured bits are the parts of your lungs that were affected by COVID.
Is this actually mine?
This is yours.
This is yours.
This is you.
Oh my goodness, it's so much.
it's frightening. Imagine that it was just going to be a blockage of some sort, but it's everywhere, isn't it?
I don't think I have ever felt that ill in my life. You can't lift your limbs and you can't walk, and the headaches.
But Rosie didn't realise she had breathing difficulties until Johnny dropped her off at hospital.
I felt so ill that I had to go to A&E, and the A&E is on the first floor and you have to walk round a circular ramp to get up there. And of course Johnny couldn't come in because of COVID, and I pulled myself up on the banister almost on my knees, and I got further up the ramp. I found I really couldn't breathe. I guess that set off a panic, so what with the not being able to breathe from the COVID and not being able to breathe from the panic, with one thing and another, by the time I got to the top, I really thought I was going to die there and then.
This was quite a typical pattern. Lots of patches of abnormal lung tissue that were inflamed.
I mean, this is your disease that you're looking at here.
It's so dense. And over there, so much of it.
Right here.
Yeah.
In COVID, because of the infection, the inflammation just goes into an overdrive. So the mechanism that's supposed to protect you from infection actually causes damage.
Right. How ironic.
As the body tries to kill off the virus, more and more immune cells gather to fight off infection, causing inflammation to spread through the airways. These yellow patches inside Rosie's lungs show the actual pattern of inflammation from her scan when she was admitted to hospital. The extent is shocking. Inflammation triggers changes that prevents oxygen from effectively entering into the bloodstream, leading first to breathing difficulties and becoming life-threatening if the body struggles to respond.
It does look really, really inflamed there.
It really looks horrible. Horrible, horrible, and you have no idea that that's going on inside you.
By the time you came in, Rosie, which was, in fact, 10 days after you've had the illness, you were obviously quite breathless. I remember kneeling next to your chair, and you asked me that question.
Yeah, that's hard to do. Go on.
So, you know, am I going to make it?
Yeah.
I still remember that.
I waited for you to say, it's going to be fine, and nobody said it's going to be fine. Yeah. They said, we don't have a crystal ball. Yeah. And you thought, I don't want a crystal ball, I just want to be fine. I don't mind if I'm here for, a little while and getting better.
Must have been so hard for you, and I've been through this as well, watching her get more and more sick and not be able to see her in hospital, and so tough.
That wasn't easy. The thoughts that were going through my mind were not pleasant. What would happen if, etc. Over the first few days, it was very, very difficult.
But to truly comprehend how this disease begins to destroy the lungs, we need to go much deeper, and that's exactly what the doctors want to show Rosie next.
Oh, so what are they, full of fluid? So it's almost like drowning?
COVID-19 has proven to be a vicious respiratory illness for many of us. But for lesser airborne infections, like the common cold, there's all kinds of well-worn home remedies. But do they actually work? Here's Dr. Karan Rajan to give us the answer.
You've got a headache, sore throat, runny nose, you've got the lurgies. But your grandma Doris told you to gargle with salt water. Well, she's not wrong. Gargling with salt water can actually help to loosen thick mucus, which can remove irritants like bacteria, allergens, and fungi. Next, she gives you some honey and lemon in hot tea. Surely that can't work. Well, actually, honey has been touted as an anti-inflammatory and antibacterial for centuries. One of the reasons for this is because it contains high amounts of a chemical called methyl glyoxal. This is also one of the reasons why we use medical-grade honey in the hospital to help with wound healing. Finally, your mum walks in with a steaming hot bowl of chicken noodle soup. Surely that's not going to work. Well, chicken is actually a good source and very rich in an amino acid called cysteine. And cysteine can act as a mucolytic agent. It can literally break down thick secretions of mucus. So these weird and wonderful traditional home remedies, they were science-based all along.
Fortunately, we don't need to look inside our bodies to know when we have a cold, but for many conditions, X-rays and MRIs are a necessity for a diagnosis. Today, we're using our pioneering technology to help 64-year-old patient Adrian. He's come to one of our imaging centres to discover more about a troubling problem with his waterworks.
Ah, Adrian, good to meet you. Take a pew.
Pleased to meet you.
So how bad is it? How often do you have to go to the toilet?
And invariably, it's in the morning when I've had my first drink, cup of tea. And I've had to go 5, 6 times in the hour.
5 times an hour?
Oh, God, yeah. And I've been in, hardly emptied my bladder, and then 10 minutes I'm back in again.
So it's dominating your life?
Yeah, completely. It's always there in the back of your mind, always.
Yorkshireman Adrian has been jet-setting around the world with his job as cabin crew for the last 37 years. Now living in London, he spends his downtime closer to home.
One of the things I really enjoy doing since I moved to London is cycling around town. It holds so much history, you can't help but be enthralled by everything that's laid out in front of you.
But there's one particular site he's always on the lookout for.
It's brilliant, is out there. It's shut, isn't it? The issue has become, where do I go to the loo? And it will be there all day. It's like having your grumpy mate with you that is always hankering for something. In this case, it's having a pee. Can I use your loo? Oh, thank you. It's with me all the time. You never escape from it.
Adrian first noticed a change in his toilet habits over a decade ago.
I didn't go straight away to the doctor because I just thought it'd right itself.
Instead, his symptoms continued to get worse, so Adrian finally sought medical help.
The doctors said, I have enlarging of the prostate that comes with age of men.
Benign prostate enlargement affects 50% of men in their 50s and up to 90% in their 80s. The prostate is a small organ situated just beneath the male bladder, and it continues to grow throughout a man's lifetime. A frequent need to pee and a weak stream are common symptoms, but in Adrian's case, he sometimes stops passing urine altogether, forcing him to take immediate action.
So this is the catheter. This is the end where the pee comes out once you've inserted it, and that's the end where you stick it down your urethra, and which is at the end of your old John Thomas. The pleasant aspect arrives shortly as this arrives in the bladder, and you're like, oh, wonderful, wonderful. It is.
While the catheter brings welcome relief, Adrian's situation is steadily worsening. He's desperate to understand the details of what's going on and find out if there's a cure.
Yeah, I am hopeful that there will be a resolution to it. Now, what's life if there's no hope? Can I go to the loo? Yeah.
What are you hoping today will give you?
yeah, I want to have a look inside and see the distortions that have appeared in my insides and how it's contributed to all this stress and these problems.
Adrian's doctor is Nick Burfitt, an interventional radiology consultant at St Mary's Hospital in London. He's come to our special imaging centre to help Adrian understand his condition and hopefully recommend a suitable treatment.
Aha! Hi, Adrian. Kate.
Hi there.
Would you like to come through and we'll take a look at your scans?
Come on, let's do it. After you, sir, after you.
Using Adrian's medical scans, we've created an exact virtual replica of his lower body so he can see his problem up close. But first, we're going to look at a healthy patient to find out where the prostate is and what it's for.
Adrian, you got yourself in the centre.
Oh, wow.
So what have we got here then, Nick?
So here we have the human body.
Yeah.
We can see the kidneys right here in the middle, and then the ureters, which are the tubes that carry the urine all the way down to the bladder, which is this kind of ball-shaped structure within the pelvis.
It's all very complicated and compact, isn't it?
At the front here, we have the testicles, two egg-like structures here. I'm holding in my hands here. So they produce sperm, which go through these tubes here, and they go up into the pelvis, round the back, and they go into the back of the prostate gland, which is this sort of ping-pong ball-sized gland, sitting here below the bladder.
Wow. It's fascinating how it's structured.
The prostate gland, which produces part of the fluid that makes up semen, is wrapped right around the urethra. That's the tube that carries the semen and urine from the bladder out of the body.
I feel nervous just standing under this.
And it's here that is the source of Adrian's problems.
Well, we've seen what the prostate, the urinary system should look like.
Normal.
A normal one. Should we see what Adrian's looks like? Do you want to have a look at your own prostate?
My grumpy mate.
Your grumpy mate. Shall we check it out?
So we have the normal subject on the left here.
Yeah.
There you go.
And we can see the prostate gland in the centre. And then over this side, this is your CT scan.
Is that the bladder?
No.
No.
Is that my prostate?
So
that is your prostate, Adrian.
This here, which looks like the size of the bladder on the previous subject, is actually your prostate gland.
It's an Olympian prostate, isn't it?
It's a shot put, isn't it? What are your thoughts, Adrian? Can you see up inside?
Yeah, no wonder I have trouble.
I mean, if you
Looking at
compare
that.
it by taking a look over here as well.
Yeah. Oh, absolutely. Oh, it's vast, isn't it?
Yeah.
It's like a big haggis. Isn't it?
It must be the strangest feeling.
Yeah, it feels even stranger now. Now I've seen it. It is. Wow.
And so we know from taking measurements from the CT scan that on this side it's 25 cubic centimetres, and your prostate gland is 220 cubic centimetres, so almost 10 times the volume.
Yeah, that's disturbing, isn't it?
While a normal prostate is about the size of a walnut, Adrian's is the size of a grapefruit.
So why is Adrian's so big? What is his condition?
So the medical name for Adrian's condition is benign prostatic hyperplasia. And what that means is that the tissue, mainly within the central part of the gland, has, over a long period, continued to grow, expanding the gland significantly.
The exact cause of benign prostatic hyperplasia, or BPH, is unknown, but it could be the result of changes in sex hormones as men age.
This is a big problem for you, but it's not cancer.
It's not life-threatening,
No.
thank goodness.
Yeah.
Although not malignant, Adrian is still desperate to find out why it's forcing him to go to the loo so often.
So here we see your pelvis again, Adrian, and what we've done this time, we've got the bladder on the top and also the prostate gland, and we've cut through the front of the bladder and the front of the prostate as well. And what you can see is that the prostate gland is bulging up into the base of the bladder. This is a very sensitive part. So if your prostate gland is pushing up and stretching this area, it's essentially giving you the urge to go more often.
How much volume has my prostate reduced my bladder by?
Well, that's difficult to gauge, but it's probably reducing it by 20 to 30 cubic centimetres.
Why is it that sometimes Adrian either has just a few drips or can't go to the loo at all?
Well, let's take a look.
OK.
The normal subject, we can see the urethra, the tube that carries urine from the bladder through the prostate gland to the penis. On the other side, we can see Adrian's, but it's much narrower than it is in the normal patient, which we see over here. And that narrowing is like the kink of a garden hose, reducing the flow of the water.
Oh, Adrian, I mean, what do you think when you see that so visually?
I'm horrified. I'm alarmed. There's almost a sense of urgency now. Seeing the volume of it, thinking, oh, God, I've got to have something done with it.
Fortunately, Nick has a particular treatment in mind.
So the procedure we're going to do is prostate artery embolization. What embolization means is blocking off an artery and taking away the blood supply to the target organ.
So you're starving it?
Exactly, that's right. And that's what causes it to shrink.
As Adrian's prostate shrinks, it should relieve the pressure on the bladder and open up that narrowing in the urethra, allowing urine to flow freely once again.
How are you going to get in, and what are you going to do?
OK.
I need reassurance on this.
Yeah.
Adrian, you come and stand here.
I bet you do. I bet you do.
So to do the procedure, we get a really tiny tube, less than 1 millimetre in diameter, called a microcatheter. And under X-ray guidance, we're going to find a way up into the main artery into the pelvis, and then into the prostate artery to this point here.
Yeah. Why that bit there?
So that's the very beginning of the prostate artery.
Yeah.
Once the catheter is in position, Nick will inject tiny plastic beads down both branches of the artery that feed the prostate until they reach a point where they are too big to pass through and block it up.
Will there be a point where the prostate stops shrinking?
Yes, what we're hoping for is at least a 25% reduction in the gland, and the most we've seen is a 60% reduction.
OK. Can I have a pint?
Big question.
Because we're reducing the outflow obstruction in the bladder won't cause the same kind of urgency and desire to go and so on. Yeah.
So I maybe should start on a half first then?
Maybe, yeah. Yeah. Just, or maybe a shandy, yeah.
Adrian may be hoping that surgery will liberate him from the loo, but on average, we Brits spend almost 30 minutes on the toilet every day. But all these trips can be bad for your health. Here's Dr. Karan Rajan to explain why.
Here are some mistakes that you probably didn't realise you were making in the bathroom, and it might improve your health. Sitting on the throne for too long is not recommended. When you sit down on the toilet for too long, gravity works against you. The anal cushions which line our bottom can actually become engorged and dilated with blood. This can result in hemorrhoids, which can cause pain, itching, and bleeding. Not fun. It's important to avoid straining all the time when you're in the toilet. This can weaken the pelvic floor muscles, which over time can lead to conditions like pelvic organ prolapse and even urinary incontinence. Do you close the lid of your toilet before you flush? If you don't, the force of the flush can actually cause a tsunami of microscopic poo particles and bacteria to float around and settle on various things you don't want it to settle on. Your towel, or even worse, your toothbrush.
In our main imaging centre, 71-year-old Rosie has come face to face with the suffocating COVID-19 virus that just 7 weeks ago put her in a high-dependency unit.
That looks so angry.
Still suffering with the effects of fatigue, she is hoping Dr. Guddi and Dr. Wong can help her understand what it is that's had her fearing for her life.
And what were you feeling? Just tell me what it was like.
I don't think in my 71 years I have ever felt such terror. Being wheeled into the room that said high risk and intensive care and all the rest of it, I just thought, I'm not coming out of here again. I just kept saying, I don't want to die, I don't want to die here, my family needs me, which was quite, it was very scary.
Rosie spent 11 days alone in hospital with COVID-19. But in her darkest hours, there was one thing that kept her fighting.
My phone was attached to the wall with a bright yellow cord, and I felt like it was my umbilical cord.
Oh, I haven't seen all of these. Did you reply to every single one?
Every single one.
You're amazing.
Some people sent me music. Some people sent me little videos. Rosie, you're a fighter. Fight. Sending lots of love from Israel, your beautiful country. Shana Tova.
Makes you cry, doesn't it?
On the Friday, when I was really feeling utterly dire, we have a song that we sing when the Sabbath comes in, and each family took one verse. I can't do this.
You can.
Here they are. Here they are. Each family took one verse of this song and they sat together as a group and they filmed themselves singing it.
1, 2, 3.
It was just amazing. It was like medicine. Just felt wrapped in a warm blanket of love and care. I can't tell you how many times I listened to them. They were the reason to get better. Oh, look, they're coming to give a hug. I love you so much too. After being a worrier, and I am a worrier, I tried to become a warrior because I realised that was the only way out of here.
This is kind of the big image and the big picture. And the reason why you were so breathless, to understand that, is a microscopic issue.
At the end of our airways, there are more than 300 million microscopic air sacs. Individually, they're far too small to be seen on an MRI or CT scan. But the doctors have created their best estimate of what they look like in Rosie's case.
Oh, amazing.
Rosie, we're looking at the alveoli here, the little air sacs right at the end of the smallest airways. And that's where the oxygen exchange takes place.
So they're like little balloons.
Look, this one shows it here. If you look at it, it's like a little balloon, it's like a little sac, and it's hollow inside. So that's where the air actually comes into it.
These are cut off.
Yeah, exactly, so you can have a look.
As we breathe in, the air sacs fill with air, and the blood vessels surrounding them collect the oxygen to feed our body.
This is all scaled up to about 1,000 times of what it should be. So we're really looking at tiny, tiny, tiny things.
And of course, the sacs are there to create more surface area.
You've got a lot of medical knowledge.
Well, I've had a bit of a crash course last couple of years, to be fair.
So I want to show you now what your alveoli looked like, probably, when you were infected.
So what are they, full of fluid?
In Rosie's lungs, the COVID virus had infected the cells along the air sac walls. And as the body's immune cells struggled to overcome the virus, they filled the air sacs with their corpses.
It's a mixture of fluid, mucus, dead cells.
It's nasty stuff.
Yeah.
Right? It's not,
Yeah, and it's filling the space that should be full of air. And that's why it was so hard for you to breathe.
So it's almost like drowning. Quite unbelievable.
Of the inflamed areas of Rosie's lungs that were affected by COVID 7 weeks ago, more than a quarter of the air sacs were completely full of fluid and unable to help her breathe.
How does it feel to see it like this?
Well, it feels very good to be on the other side of it, that's for sure. It's very hard to take in.
And Ernie, what did you do for Rosie once you realised that she had COVID?
The treatment, Rosie, was all around how can we stop the lungs from getting more and more inflamed.
To reduce the inflammation and essentially save Rosie's life, Dr. Ernie Wong prescribed medication that was the result of international trials involving Imperial College Healthcare NHS Trust. He also had her fitted with a CPAP, a respiratory machine that wraps around her face and head and pushes oxygen-rich air into her lungs.
I'm claustrophobic, and the thought of having something clamped tight to my face and you can't see properly, I couldn't do it. There was one particular nurse who was out of this world, and he just sat there for hours. We're going to do this. We're going to do this together. This is going to save your life. Sorry for my tears.
No, that's totally right.
It was quite awful. Oh. But as I say, the staff were outstanding.
Awful that she got sick, but if she was going to get sick, better now than right at the start, you know.
Indeed, but, you know, I'm somewhat humbled because I know that you're going through a lot, far, far worse than we went through.
Well, it's very sweet of you to say so, but actually, his lungs are doing better. You know, he's out of the coma, he's off the tracheotomy, he's breathing on his own. But the damage is throughout the whole body. But, you know, you can see the impact even just on the lungs, can't you, like that? It's going to be huge.
Although nowhere near as badly affected as my husband Derek, Rosie also hasn't fully recovered. She suffers with extreme physical fatigue, which could be the result of permanent lung damage.
I'm absolutely petrified it may happen again, but I would like to know how we should medically go forward from here.
So our usual next step would be repeat chest X-ray to see if there's any ongoing damage or scarring in your lung tissue. Some patients, even after they've fully recovered from the COVID infection, may well be breathless in the long run. So this is something that it's really important for us to capture.
I'm just very grateful to have had this amazing opportunity, which I'm sure most people don't get.
Here she is.
What did you think?
Oh my goodness, that was just something else. It's the most fascinating thing I've ever seen in my whole life. It was just unreal.
Did you see your heart pumping away there?
Thank God. I'd be more worried if I hadn't seen it pumping away.
You'll never take a breath in again the same way, will you?
I will never see life in the same way again. I'm just hoping that although there is going to be a scar on my brain forevermore, that will be the most of it and we can carry on with our lives. with our kids and our grandkids and all the pleasures that God gives us in this world.
Well, best of luck, and we'll catch up with you then. Thank you for sharing such an extraordinary moment for you today.
Thank you.
Rosie will need a scan in 2 months' time to determine if there is any long-term damage to her lungs. But as for 64-year-old Adrian, it's the day of his procedure at St Mary's Hospital in London.
Morning, Adrian.
Morning, Nick.
Good to see you.
How are you?
Adrian has an enlarged prostate that often blocks urine from getting out. So today, Dr. Nick Burford is going to inject tiny beads along the arteries that feed the organ. This should stop the blood supply and eventually cause the prostate to shrink.
Anything you want to ask me, or anything you're not sure
No,
about?
you seem to know what's going on. You've passed the oral exam. You're free to carry on.
Yep, thank you very much. Good. OK, so just come and do this up, please. Thank you.
Adrian's operation will all be done via keyhole surgery and a local anaesthetic, so he'll be awake throughout.
OK, so Adrian, just going to have a look at the artery in the groin there.
Yeah.
Are you OK?
Yeah.
Good.
Before Nick can inject the particles into the prostate, it's crucial that he finds the exact arteries that feed it.
So we're just getting our access into the arterial system. We punch the artery with a needle.
From an entry point in the groin, Nick steers a catheter through the blood vessels, going deeper and deeper towards the target arteries.
Looks like you should shoot straight in there.
The procedure is only possible because of live X-ray imaging, which allows Nick to navigate his way through.
So we're in the prostate artery. We're just manoeuvring the catheter now to get in a good position to put the particles in. Hundreds of tiny particles, 250 microns in size, to block all the really tiny arteries inside the gland. But Adrian's got quite a big gland, and so it's taking quite a lot of particles. That's the fourth. OK, right, great. So, Adrian, how are you doing?
All right.
Any strange sensations anywhere?
Really? No, just
Penis feels OK?
Me what?
Your penis?
Yeah. Well,
OK.
Yeah.
Not hurting?
No. No.
OK, that's good.
It's looking good, and after repeating the whole procedure on the other side of the prostate...
That's the one we won't want to go into, so that's good.
Nick's work is done.
That's good. Great. OK. Fantastic.
Go get a cup of tea.
Yeah.
Time fly when you're having fun.
Good. See you a little bit later, Adrian.
Thank you. Thank you very much.
But only time will tell if the procedure has really worked.
The next couple of days will be a clincher for me. So I'm going to be constantly now waiting to see what the improvements are, gauging it on every P, really.
'71-year-old COVID survivor Rosie is making her way back to St Mary's Hospital, where just 3 months ago she was here fighting for her breath and her life.
When I was at the front entrance, it was OK. Coming to see my ramp here, which was where I virtually climbed up on my knees, it's a little bit harder. It looks much less steep today.
Having seen in the imaging centre the severity of what COVID did to her lungs...
Oh, my goodness, it's so much.
Today, she's having a scan to see if it has caused any permanent damage. The X-ray will be analysed by consultant radiologist Professor Susan Copley.
The X-ray is very important. It's a really vital part of the jigsaw to determine whether she's actually on the road to recovery.
OK, Rosie, take a big breath in.
And I very much hope that the abnormalities that we saw on the initial CT have resolved or are significantly improved. We won't know that for sure until we see her chest X-ray.
And breathe out. OK, all finished. Thank you.
In a week's time, Rosie will get the results of her X-ray.
I think, although you may physically become, you know, proper, normal and healthy again, the anxiety and the instability and the unsureness, the uncertainty of all the things that go with COVID, I think will never go away. If you want the truth.
Good afternoon.
Hello. It's been 16 weeks since Adrian's procedure to try to bring his oversized prostate back down to size. He's had further tests, and today he'll get the results from consultant Dr. Nick Burfitt.
I'm sure you've got lots of questions.
Lots.
So let's go and ask them, shall we?
Yes.
All right, come with me, yeah?
Things have improved immeasurably. But I need to see Nick is for him to give me the internal diagnosis of what's occurred.
Hello.
Hi. And the way forward, is this just a fleeting relief, or is it going to be for the rest of my waking days?
How have things been since we did the procedure a few months ago?
Fantastic. Wonderful. There was a lot of discomfort at first, but the discomfort disappeared within 10 days, 2 weeks, and it's just progressively improved. How long will this continue? What's the guarantee?
The prostate gland is always trying to grow, so it is quite likely that at some point in the future there could be a recurrence of your symptoms. However, before we did the embolization, your prostate measured around about 220 cubic centimetres, and on the current MRI, it's now 135 cubic centimetres, so that's a 40% reduction in the volume of the gland.
Wow.
Generally speaking, we're happy with anything over 25%, so given the reduction in the size of your gland, I think you're likely to have quite a persistent result from this, and so I think the outlook is good going forward.
That's fabulous. Still a big thing, but...
It's not gone completely,
No,
is it?
no. More room down there. But,
That's like almost half of it gone, though.
Yes, thanks very much, Nick. You've changed my life.
Oh,
No,
you're too kind, Adrian. Thank you very much.
No, you have. You have. Today I'm walking up Malham Cove. Back in the summer, this would have been a difficult walk for me, purely because there's no cover. There's nothing to stand behind if you want to pee. Something remarkable's happened. I just urinate as I'm designed to urinate now. It's fantastic. It really is.
With the future looking bright, there's just one more milestone left for Adrian to conquer.
That's really nice. That's the first beer I've had in a pub for a long, long time. A long time. Nice Yorkshire beer, too. Oh. I'll stick to a half, as I'm not so adventurous yet.
Hello.
Hello, Rosie, good to see you.
Nice to see you too.
It's been just over a week since Rosie went for the X-ray that will determine if she'll ever recover from her devastating bout of COVID-19. And today she gets her results.
So you're hoping that the X-ray shows what? What would be good news?
I wish I could see it in 3D again, and I could see those tiny little alveoli not full of revolting, noxious, gunky fluid.
Well, I can't come in with you this time because we've got to keep everything restricted for COVID, but I will see you afterwards, so good luck.
I look forward to that.
See you soon. I will see you afterwards.
See you soon. Thank you.
Come in.
Rosie's checkup is with Dr. Wong.
Hello.
Hi, Rosie.
Hello.
So overall, Rosie, how have you felt since leaving hospital?
There are days when I have bad times, bad turns, but the intervals between them are getting longer. So I hope that I'm going in the right direction.
So I'll show you your X-ray.
Yes,
okay. So so Rosie, this is your chest X-ray from last Tuesday. Overall, it's a lot better. We don't think it's quite 100% back to normal just yet. You do see areas that are probably slightly denser than you would like, but we're very hopeful that actually all the changes here will go back to normal.
The rest will happen by itself.
Yeah, I'm actually very happy to give you the all clear, but moving on this winter and beyond, it'll be really good to get out there, keep active, and to get your fitness level back.
I don't know how to thank you. You've been absolutely wonderful. They told me when I came in that if I got Ernie Wong, I would be lucky, and I feel very lucky. So between you and the Lord above, you have looked after me, and I look forward to getting even better and getting back to my own life. Yeah. Thank you so very, very, very much.
Rosie! Sit yourself down.
Oh, thank you.
How was that?
That was amazing, thank you.
Was it?
It was amazing. There's no scarring anywhere.
Oh, that's a big thing.
And all in all, he said I tick all the boxes and everything was fine. I don't know what else to say. He was very pleased with me, which made me pleased with me, and that was the best I could have hoped for.
You're beaming. I can
beaming.
see this is a fantastic moment.
I'm feeling much relieved, I have to say. It's almost like, it's like magic. It's like I've been through a long, dark tunnel and I've come out the other side, and it's not exactly where I was before. It's somewhere else. It's a new place and it's a new start. I'm very, very grateful to God and to Ernie Wong.
I'm not allowed to hug you, but I want to. I'll do this.
Right, who's starting? Youngest first. Every morning we say a prayer where we thank God for giving us back our soul. And every morning I say it out loud in my room. God should know how grateful I am to be back with my family and my kids and my gorgeous husband. Show off. After all that, it's...
I feel that we're getting very much towards closure, and the whole episode will be behind us. But it's certainly been quite a journey.
It's wonderful.
It is wonderful. It is wonderful. And in the fullness of time, I hope that Derek gets there too.
Well, we'll see.
Even if he only gets halfway there, it will be an improvement on now.
Of course it will.
Yeah.
Yeah, of course it will. Thank you. Thank you.